Hi, hello, welcome back. So today we will be seeing about microbiology topic. The code series for that is 87040-87158. It is a topic which is coming under CPT pathology. We have added a list of playlists so that you can go through that topics also. Microbiology involves the study of microorganisms such as bacteria, virus, fungi and parasites. In pathology, these tests are crucial for diagnosing infection and guiding the treatment. Key concept in microbiology coding is, first you have to know the type of microbiology test. Culture, that is growing microorganism from the sample. Next, identifications, identify the specific organism. Susceptibility testing, determine with which antibiotic can effectively treat the infection. And then common microbiology CPT codes. For culture, the code series are 87070, 87081, 87101. So that is 87070 is bacterial, 87081 is presumptive and 87101 is fungal. And for identification, 87077 for aerobic isolate and 87106 is for culture bacterial identification, 87110 is for culture chlamydia, any source. Common microbiology CPT codes for susceptibility testing is 87186. Susceptibility studies antimicrobial agent, microdilution or agar dilution, minimum inhibitory concentration per method. Molecular testing 87536 and 87635. 87536 is an infectious agent detection by nucleic acid and 87635 detection by nucleic acid, severe acute respiratory syndrome, coronavirus. Examples, first one is bacterial culture and identification. A patient presents with wound infection. The doctor orders a bacterial culture. So the test type is culture and presumptive of bacteria. We are giving 87070. Example 2, for fungal culture, a patient has a skin infection suspected to be caused by fungus. The doctor order a fungal culture. So the test is fungal culture. So we are assigning a CPT code 87101. Third is antimicrobial susceptibility testing. Here the bacterial culture from a patient's urine has identified E. coli. The doctor orders susceptibility testing to determine which antibiotics will be effective. So here antimicrobial susceptibility test for E. coli is done. So we are giving 87186. Tips for accurate coding: choose the right code. For first you have to check for the culture, identification, susceptibility and molecular testing. Based on the documentation, we have to assign the proper code. Conclusion: coding for microbiology in pathology involves understanding the type of test performed, selecting the appropriate CPT code and documenting the reason for the test and its result. So that's all about the topic microbiology. Thank you so much for watching. If you haven't subscribed my channel, please do subscribe, and if you find it interesting, please do share it with your friends also. If you have any doubts, you can put it as a comment also. Thank you so much for watching. Thank you for your time. Take care. Bye bye.